welcome back. Now we will have a debate session. If you wish to speak, please leave your name and nationality in the chat box. Then I will invite you to speak on a first come, first served basis. Please press unmute button when you receive the unmute request. Before collecting more questions or comments, we have a question for Mr. Jiao Zhang at the China Daily. You said you wrote many stories about Dr. Li Wenliang, who is famous for breaking the news of the new coronavirus. Can you tell us a little bit more about the stories you wrote?
Oh, yes. Thank you very much for this question. Dr. Li we reported on Dr. Li when he was first apprehended by the police, and then he has to sign a paper for essentially for getting a squirrel. And then we follow up on Dr. Li after he got sick, and we also follow up on him when he was in the hospital. And unfortunately, on the day he passed away, I think it was February the 7th when he passed away. We follow Dr. Li throughout his time and throughout his trial and tribulation, and it is a really heartbreaking story. But at the same time, it is also a story, I think, that has been misrepresented by Western media, particularly because a lot of Western media have portrayed him as an anti-establishment hero because he spoke out against the silent. The thing is, there was a doctor, Zhang Jixian, who already spoke out 2 or 3 days before him. I think it was on December 27th. So in a sense, Dr. Li wasn't the very first whistleblower that blew the whole thing out of the water. And at the same time, I remember if it was CNN or other Western media, they said that after Dr. Li got scolded by the police, he was silenced. He was not silenced because we interviewed him. And also he was taking interview requests, not only from domestic media, but also foreign media. And he also returned to work, surprisingly, and to treat the COVID patients at the time. And I think that's how he got sick. And Dr. Li has always been a very illuminating figure in our reporting. And it's one of the things that a lot of foreign media don't like to shed light on, is that Dr. Li is actually a very active member of the Communist Party of China. I remember seeing some foreign reports when they used the famous Dr. Li, the now famous Dr. Li portrait, the one with him with the mask. He was actually wearing a party button on his coat, and I see a lot of foreign media crop that part out when he was when they were portraying his story, which is kind of weird, and also a little bit disheartening, because he was such he loves his country, and he is also very engaging on social media, especially on Xinlang Weibo, which is right now people are leaving millions of comments on his posts. It's almost like a wailing wall of Jerusalem, in a sense, people sharing their personal stories. And we keep following Dr. Li for quite some time, even after he passed away, because we had to write stories essentially refuting and debunking some of the misconceptions that Western media have. However, I think if you want to say, when do we start writing about Dr. Li, I think
sorry about the technical issue. Is it on? we'll come back to him after the technical issue is solved. Next, I have a question for Mr. Mohamed Nasir. Here's the question. Can you share with us about the impact the COVID-19 have had on the current media situation in Indonesia? What difficulties are you facing? That's the question.
Thank you very much for the questions. In Indonesia, press media is a kind of an important infrastructure for information. This is important for public, people, and the government. So the press media has been hit twice by corona pandemic, and technology disruption. So this is very heavy hit for the press all over the world, I think. But especially for Indonesian media, we have a Media Sustainability Forum. The Media Sustainability Forum has been managed by Press Council, work together with a government, Ministry of Finance, and Ministry of Information. That talk about the sustainability media in Indonesia and how to solve the crisis for media. At the moment, media from Indonesia has been helped by the government, by finance, according to how big the role to against the COVID, and how big the leadership for its media. The helping, the money has been given for the company of media, not for journalists. But for the journalists, council has held to intensify the role of the press by fellowship for journalism, for changing the behavior to the people. The people must using masker, washing hand, and social distancing. The media must spread that information like that, and the government work together with COVID-19 task force has collaborated with Press Council, recruited 5,000 journalists to make the news every day, and then they have been given by government honorarium every journalist. So that means the government had the journalists in the crisis situation in pandemic, COVID-19 especially like that. I think like that. Thank you.
Thank you very much. Next question we have is for Mr. Ashraf Eldali. Here's the question. Some countries require journalists to get coronavirus vaccines along with... Okay, he's away now, so I'm gonna move on to the next question. My next question is for Mr. Cho Dong-chan. We have seen many negative consequences the coronavirus has brought to the world. Do you find, if there's anything positive about this crisis, What do you think it is?
네, 국제적인 측면에서 이건 그냥 개인적인 견해입니다만 국제적인 측면에서는 코로나19가 팬데믹이 되고 나서 세계 공기가 맑아진 것, 인도의 타지마할 그 궁전인가요? 그런 것들이 하는 것들, 환경이 좋아지는 모습들이 보여지는 거는 좀 개인적으로 좋았고요. 물론 제 전문 분야는 아닙니다만. 근데 의료계 쪽에서 대한민국에서 벌어지고 있는 것은 두 가지가 있습니다. 그동안 한국의 병원 접근도가 낮고 의료 수준 뛰어난 한국의 의료의 장점이 있었는데 고질적으로 문제가 제기되었던 것은 과잉 의료, 한 사람이 너무나 병원을 많이 가는 것 아니냐, 그런 것들이 항상 논란이 있었거든요. 그게 긍정적일 수도 있고 부정적일 수도 있다. 왜냐하면 함부로 줄이지 못했던 게 병원 진료를 줄이면 그게 국민 건강에 악영향으로 어떻게 나타날지가 몰랐었거든요. 그런데 코로나19가 돼서 어느 병원이든 감염병의 위험성이 커지니까 최소한으로 했습니다. 병원 이용을. 그래서 실제로 그러니까 코로나19가 팬데믹이 되기 전이랑 그러니까 비교하면 진료양, 그러니까 병원 방문의 수는 현저히 줄었는데 나머지 건강 지표가 별로 나빠지지 않았습니다. 물론 이제 코로나19와 관련된 그 응급 상황의 문제는 나오긴 했지만, 그래서 꼭 필요한 의료, 그러니까 코로나19는 반드시 꼭 필요한 행동만 하게끔 우리를 만들었잖아요. 의료에 있어서도 불필요한 의료 행위를 줄이는 그런 효과가 있었고요. 저희 개인적인 일터에서는 그동안 우리 언론사, 저희가 속한 SBS는 모든 사람이 다 회사에서 나와서 공동으로 일하는 것이 원칙이었습니다. 그러나 언론사에도 확진 환자가 나오니까 최소한의 근무 인원만 모이고 나머지 인원들은 집에서 근무하는 형태를 띄었는데 정말로 많이 걱정했습니다만 막상 해보니까 그렇게 별로 손해가 평상시와 차이가 없었습니다. 우리가 너무나 걱정해서 과도하게 병원을 갔었구나. 우리가 너무나 걱정해서 너무 모여서 일했구나. 그런 부분들이 있었고요. 또 개인적으로는 코로나19가 우리의 일상을 제한했습니다. 우리나라에서는 식당이나 카페에 갈 때 인원이 제한되고 시간이 제한됐습니다. 예를 들면 5인 이상 모일 수가 없었고요. 지금은 밤 10시지만 밤 9시까지밖에 식당이나 카페를 이용할 수 없었는데, 그러다 보니까 어떠냐면 꼭 보고 싶은 사람만 보게 되는 거예요. 우리 이제 사회적인 그런 그러니까 인간관계, 사람 관계에서 사실 내가 정말 이렇게 많은 사람들을 만나야 되나, 이런 것들을 벗어나지 못했었는데 코로나19가 터지니까 정말로 나에게 소중하지 않은 사람은 관계를 정리하고 나에게 소중한 사람들만 다시 생각해서 만나는 그런, 개인적으로는 그런 부분들은 긍정적인 요소였다고 생각합니다.
Thank you, Mr. Joe. Mr. Zhang, are you back online?
지금 없어요. 왔다 갔다 하시니까 그냥 여기로 넘어가면 돼요. 디베이트로 넘어가서 발언권 그냥 여기 주시면 돼요.
Are you back online?
Yes, thank you, Kamakura. Can everybody hear me?
So you were talking about what were you talking about before you were off?
Oh, can you hear me?
Yes.
Oh,
Now we can.
yes. Sorry for my technical issues. I was just concluding my answer for the question. I think that we have been going through a sustained coverage of Dr. Lee because his situation and his status was closely followed by pretty much all media in China as well as around the world. And even after he passed away, we also wrote stories and profiles on him. And I think the media attention really began to start to drop off in May 30th. That's when his wife was about to have a child, and she essentially wrote a public statement saying that all media should just essentially give them a peace of mind. and that's essentially where we stop covering about Dr. Li.
Okay, I have another question for you. How does the local media feel about the view that China, the Chinese government, is engaged in vaccine diplomacy?
Well, that's a very interesting question because I'm not really sure how do you define the local media. Do you mean the local media in China or the local media in the designated countries where the Chinese vaccines are going to? I probably think it's very interesting to see that foreign media, especially Western media, has been creating this narrative that everything China do is for geopolitical gains. I remember writing articles debunking face diplomacy when face masks was in shortage. When China was exporting its face masks, people say it was face mask diplomacy. Then there was respirators and ventilators, medical equipment diplomacy, and right now there's a vaccine diplomacy. So it's very strange because what China do is not everything China do is for geopolitics. It's not the Pentagon, and because why does China wants to offer its vaccines to, I think right now over 80 countries, including Turkey, Indonesia, Chile, Brazil, and many African countries, and especially developing countries, is that China understands that only if everybody else gets vaccinated and everybody else gets saved, only then can the world as a whole overcome this pandemic. Because right now, China, although internally China has successfully tamed the virus within its borders, but right now there's the probability of an outbreak caused by the import of cases is still very high, especially with the new viral variants that's going on. Right now, they're not very prevalent in China because we stopped them at the borders. And that's why China has been very actively joining the COVAX and giving out vaccines. And I think it's strange that China gets most of the smearing when other countries like the US, which is also giving vaccines to Canada and Mexico, as well as Russia, which is also giving vaccines to some of its partners, China gets the most flack. And this is kind of as a science and technology reporter, this is a bit disheartening because a lot of people, when they analyze some of the host countries that China, some of the countries that are taking Chinese vaccines, though they say, oh, they're all China's allies and stuff like that, but they're not essentially. I think many of them are sovereign nations, and they're very capable of making their own decisions. They have consulted their experts and health authorities when taking in Chinese vaccines. And China don't need to impose its vaccines to anyone. And that's my answer for this question. Thank you.
Thank you very much, Mr. Zhang. Now we are moving on to Mr. Leondio Ferreira from Portugal. Any comments on today's topic?
Hello, good morning. In Lisbon, it's still morning. It's very interesting, all the communication we have been hearing. I have a general question. My newspaper is the oldest Portuguese newspaper. It was founded in 1864, and is one of the quality newspapers of my country. In March last year, when the pandemic arrived in Portugal, we, in our online edition, we have the best months ever in our history in terms of readership. 3.3 million people per month, usually it's 2.1 million. It was the biggest increase in percentage in all the Portuguese newspapers, but the same kind of increase happened with the other quality newspapers. At the same time, because of the lack of the advertising and with the fall in the print edition, our media group have to adopt a layoff, as a lot of Portuguese companies in other areas. Then my conclusion in that moment, now we have a new investor and things are going a little bit better, is for the quality newspapers in Portugal, the pandemic was really incredible in terms of recognizance by the readers of the importance of the good journalism. It was really incredible in terms of readership online, but at the same time, it was terrible in terms of income, in terms of the economic health of the media group. This is something that happened also in your countries. Two questions. The increase of the readership, mainly in quality newspapers. Second question, the economic crisis affecting the media, even if the level of readership is higher than before. Thank you very much.
Thank you. Mr. Chun Yongil 원장님, any your response to?
This is actually the question about the media consumption, right? So whether there has been any change in the readership, newspaper readership, or the media consumption. This was the one thing that actually came out in one of the presentation by our colleagues. Probably, when it comes to this kind of data, I have to rely on other speakers on this podium. But just to be brief, I think that there has been, how to say, the increasing desire to learn more about what is happening in Korea and then elsewhere. The reason I say that is that I returned to Korea in 37 years, 2 years ago. So my mind is an American, but I think my thoughts is an American, but my body is in Korean. So I'm still having this kind of struggle. But one thing I noticed here in Korea is that Korean people, I think they tend to compare what is happening in Korea with things in other countries. Even when they think about their own situation, they compare things within their households with folks in their neighboring households. So when it comes to media, when we have all this experience with the COVID-19 vaccine, daily cases and then death and then things like that, I think the Korean people also turn to what is happening in other countries. So that this is where the media comes in. So in that respect, I would say there has been increasing the appetite for learning more from the international media and what is happening in other countries. But I would not necessarily be able to provide any data about the media consumption, whether this was the up or down before and then after the COVID-19. So that would be my short response to this question.
Thank you, Mr. John. Now I'm going to pass the mic to Ms. Kirtikorum Blow. Any comments on any of the topics brought up today? Issues brought up today?
I think the interesting thing that we keep talking about how the demand of media consumption is up. I think it's up in every country. And for a little while, we saw that a lot of business starting to slow down on that spending. At first, people wouldn't think that the media will be affected because we got more viewership, more readers, But at the end, we also get affected because the sponsor wouldn't pay. Before I worked for Thai PBS World, I was working for a private-owned online media called Spring News, and we all asked to get 20% off cut of our salary, and that's a lot for a senior position. And yeah, we got pretty much affected financially like everybody else. And there is another comment that one of the speakers said about the safety, one or two speakers said about the safety of journalists. It is one thing that a lot of people didn't think about. The journalist occupation is actually one of the very risky profession in any conflicts, any situation, like when you have protests or in this pandemic, you have to find answer for people, you have to report this. But then a lot of countries, including Thailand, the organization really not really equip their reporters to be ready for this kind of situation, or not really aid them with tools and everything. Like I got 2 masks and hand gel in my office. That's not gonna get me away from COVID-19. It's, but that's all the company can help me with. So that's my comment on some of the topics that people said.
Thank you very much. Then I'm going to pass the mic to Ms. Nilima Mathur. Hello. Any comments on any of the issues brought up today?
Well, actually, I had sent in my comments earlier. Greetings from India, because I think there is a point that needs to be made. It is quite appropriate that the JNK chose the 2 topics of climate change and post-COVID era in one conference. There are many factors that apply as much to climate change as they do to the post-COVID era in context of journalism, particularly because there are intersections between reliable reporting, practicing empathy even within highly scientific reporting, dealing with identities and communities, and all in a world that is now almost definitely moving into and preferring a permanent work from home scenario. The world of the newsroom has completely changed, and the reimagined model will certainly have to be highly technology based. The COVID area has also shown us that we need clear, accurate, reliable information that people can understand. Where does that leave us in terms of being connected to people? It entails a whole new paradigm of approaching the way we gather content. There is no doubt that the social media will continue to overpower print and television. A lot of it will be based on artificial intelligence that induces database stories and are powered by algorithms. There have to be new creative efforts to gather news and content and give it a human face. Maybe, like in the case of climate change, also develop new values and emotional literacy in journalism. Certainly, we need a strong and new entrepreneurial spirit to beat poor quality or disinformation as it exists on the internet today. In the last WCJ conference, I had made a specific mention in my comment for the fake news and the future of journalism session. It is a really pity that it has not been heard as it should be. JNK particularly has the bandwidth and the support to initiate it. We need to create a chain of media and information literacy based, citizen pertinent, and more dependable grassroots information. Cross pollination between civil society and media is the only way forward to connect people and understand lives. This can be done through online sessions that provide the various competencies, particularly technological, to both the media and civil society. It would be an excellent way to change the mainstream news narratives as they exist today, which I assure you audiences are very tired of. There is media fatigue because of a severe disconnect with human beings. People want news and information that has meaning in their lives. I do have a kind of blueprint for the path ahead and would be happy to collaborate with JAK for any steps ahead. The model can begin on a small scale in South Korea and then be taken right across Asia, country by country. I assure you it will change not just how news is created, but democratize society in unimaginable ways. The Asian model will surely pave a pioneering path. Thank you for your attention.
자리에서 일어나 손을 들어.
Thank you very much. Last but not least, let's hear it from Mr. Kuban Tabaldirov, who is in Kyrgyzstan.
Hello, everyone. The question is to Korean medical specialists who are following the COVID situation in the Asia region, maybe in the world. As you well know, many countries are already getting a third wave of COVID-19, and not many of them have possibility to have vaccines. So the question is, what is going to happen to these countries and how they will manage to fight against COVID-19? Thank you.
네, 사실 저희 대한민국도 백신을 충분히 공급받지 못하고 있는 상태라서 저희 백신 접종률도 한 2% 남짓이거든요. 저희가 이제 뭐라고 이제 해결 과제를 제시할 수 있는 입장이 아니라는 건 먼저 말씀드리고요. 이번에 드러났던 문제 제가 잠깐 말씀드렸지만 예전에 작동했던 시스템이 이번엔 작동하지 않더라. 예전에 뭐냐면 에이즈 치료약, 에이즈 그다음에 결핵 백신 이런 것들이 개발도상국에 혹은 아시아 국가에 보급이 잘 됐어요. 왜 그러냐 봤더니 그때는 선진국들에서 그런 백신을 만들고 생산한 나라에 그런 문제가 당면하지 않았어요. 그런데 이번에 코비드가 처음으로 근데 물론 2009년도에 신종플루 팬데믹 때는 그때 선진국들도 당면했는데 미국, 유럽도 당면했는데 그때는 풍부했어요. 왜냐하면 원재료가 많았거든요. 그런데 코비드 백신을 이게 드러나고 보니까 생산이 부족해요. 왜 그런가 봤더니 원재료가 부족합니다. 그런데 이런 백신의 이 수급 물량들이 보니까 선진국들도 다 당면해요. 미국, 영국, 프랑스, 독일 다 이 백신을 생산하고 원래 뿌렸던 국가들이 자기네들이 당면한 국가에서 이게 뭔가가 허겁지겁 되다 보니까 이게 내놓을 수가 없는 그야말로 이제 저희가 보기에는 선진국들의 아주 현실적인 금연이 봤는데 그렇다면 어떻게 해야 되느냐. 우리가 지금 이 백신에 대해서 이번 거 쉽지 않습니다. 해결책 쉬워 보이지 않아요. 대한민국은 어느 정도 경제력이 있고 국력이 있는데도 쉽지 않습니다. 이웃나라 일본도 총리가 미국 파이저 CEO한테 가서 이게 어떻게 사정을 해야 되는 그런 형편이기 때문에 쉽지 않은데 지금 말고 앞으로는 어떻게 해야 될 것이다. 이번의 교훈은 어떤 나라가 백신을 확보하느냐. 임상시험에 참여했던 국가, 백신 개발에 같이 참여하고 연구를 했던 국가가 백신 확보권이 있는 게 확인됐어요. 이번에. 그렇다면 어떻게 되느냐. 우리가 구걸하고 이런 나라들이 이제는 선진국들이 자기네들도 어려우면 안 주는 게 확인됐으니 그럴 때를 지금 뭐냐면 세계보건기구도 그렇고 코박스도 그렇고 가비도 그렇고 지금 국제기구가 지금 작동 안 하고 있는 상태지 않습니까? 그리고 냉정하게 얘기하면 국제기구들은 선진국 입김이 가장 센 것도 있고요. 그렇다면 그렇지 않은 국가들이 어떻게 해야겠느냐? 그거를 참여해야죠. 처음부터. 그리고 그 참여하는 연구 실력이나 비용이 부족하다면 국제기구에게 그런 걸 원조받아야 돼요. 처음에 원조받아서 나중에 완성된 백신 나눠주지 말고 애당초 처음에 연구비 될 때 우리가 낼 수 있게끔 도와주고 우리가 이 연구에 참여할 수 있게끔 도와줘. 이 방법이 맞지 않을까 싶습니다. 지금 코비드 백신은 사실상 쉽지 않아 보입니다.
Perhaps I'd like to say a few more words. I'm going to speaking on a few comments my colleague just made. So I'm an optimistic realist. The reason I say that is that when we had this pandemic, a lot of people were actually concerned whether we are going to have any vaccine within next 2 to 3 years. I think perhaps I'll say, my personal story. My wife is actually in charge of vaccine treatment at FDA in the United States. So I have day to day, I think, the understanding of what is happening there. When things were, unraveling in a rapid speed, nobody guessed we are going to develop vaccine within a year. This was a record in history. This has never happened. It usually takes about 10 years to make this kind of vaccine. But this was the crisis. All, I think, the scientists and then all people actually collaborated in record time and supporting each other. It happened within less than a year, and we made it. Now the question is that how to allocate, how to distribute it. And this is the part that we are not well prepared, just like my colleague from SBS just noted. So I think we'll learn how to muddle through this kind of crisis as a kind of next phase. So we need a little bit more time, but I think I'd like us to trust in collective wisdom and collective efforts that we are making as a human beings. And so that's the one thing. And second, I also like us to be actually better prepared for some other, post-corona, I think, the effects that we know about. We discussed a little bit about sort of this psychological and the mental well-being we are quite concerned about. We already know there are a lot of this post-COVID-19 trauma and sort of, these symptoms among many patients who have already recovered. This is an issue perhaps for each country, I think, joining this conference today. So I think the reporters, journalists, scientists, specialists, we all need to be better prepared how to care for these people who have already gone through, recovered from the COVID-19. We need to have really long-term battle against this COVID-19. This is not something we can handle just in a couple of years. It's going to have lasting impact. So that's something that I'd like us to be working together across different continents for the next few years in terms of reporting, medical science, and then other ways that we can support each other. Given very short time, that's something that I just like to, I think, leave with all of us.
Thank you.